Hello everyone. Today our topic is vascular supply of excretory system or urinary system. In this video we are going to cover about gross structure of kidney, vascular supply of excretory system and its flow chart of blood supply of kidney and innervations or nerve supply of kidney or a excretory system and vascular access of dialysis patients. Clear? Firstly, we are going to discuss about gross structure of kidney. Your kidney lie on the either side of the spine in the retroperitoneal space between the parietal peritoneum and the posterior abdominal wall. It is well protected by muscles, fat and ribs. Clear? Your male kidney is typically larger than the female kidney. Your kidneys are well vascularized and receiving about 25% of the cardiac output at rest condition. Now we are going to discuss about external structure of your kidney. Your left kidney is located at about T12 to L3 vertebra. T it means thoracic vertebra 12 to L3 lumbar vertebra 3. Your kidneys are located here. Where areas right kidney is lower due to the slight displacement by the liver. Clear? Each kidney weight is about 120 to 175 gram in male or 115 to 155 gram in female. Okay. Your kidneys are covered by a shock absorbing layer of adipose tissue called the renal fat pad. On the superior aspect of each kidney is the adrenal gland. Your adrenal gland directly influences your renal function through the production of a hormone called aldosterone to stimulate the sodium reabsorption and blood pressure regulation. Clear? Now we are going to discuss about the internal anatomy of your kidney. Your kidney outer region is called the renal cortex and the inner region is called the renal medulla. The renal columns are the connective tissues extensions that radiate downward from the cortex through the medulla to separate most characteristic features of the medulla. Renal papilla are the bundle of collecting duct that transport urine made by the nephrons to the calyx. Renal columns also serve to divide the kidney into 6 to 8 lobes and provide a supportive framework for vessels that enter and exit the cortex. Clear? This is the internal structure of your kidney. Outer region is called the cortex and the inner region is called the medulla. Right? This is the outer structure is called the cortex and this is the inner structure is called the medulla. You can see easily renal hilum, renal vein, renal nerve and renal artery. This is the exit or a entry point is called the renal hilum, right? Then renal hilum is converted into a renal pelvis, right? And then renal pelvis, this is the renal pelvis, right? This is the renal hilum. Here the renal vein, renal nerve and renal arteries are exit or a entry site, right? And further renal hilum is further goes converted into a renal pelvis. Then renal pelvis is further converted into a major calyx, then minor calyx, right? Major calyx or minor calyx. Then it's the pyramid structure. It's a pyramid-like structure, and this is the thread-like structure. It's called the papilla. It is a bundle of collecting duct, right? And this is the columns. This is the columns is the connective tissues in your kidney, right? And this is the ureter and You can see easily this is the internal structure of your kidneys, right? Renal hilum. Renal hilum is the entry and the exit site for structure receiving the kidneys, vessels, nerves, lymphatics and ureters. Clear? The renal hilum is the entry or the exit site, right? Renal hilum is the entry or the exit site. These structures make a renal hilum. Emerging from the hilum is the renal pelvis, which is formed from the major and the minor calyx in the history, right? Renal arteries from directly from the descending aorta, whereas renal vein return cleansed blood directly to the inferior vena cava. Now come back to our topic, blood supply of kidney or the vascular supply of kidney or a excretory system. Clear? Now, renal blood supply. Your kidney receive 20 to 25% of the cardiac output. It means 1200 ml per minute through the right and left renal arteries. Your kidney receiving blood. Clear? Renal artery divide to form a afferent arterioles. Your renal arteries get divided to form a afferent arteriole. Then afferent arterioles come in contact with a nephron. Then your nephrons get filtering blood and removing nitrogenous wastage in the form of urine, and cleansed blood returned back to your body, right? Now each nephron receive one afferent arteriole which divide into a capillary network called the glomerulus. Here the blood is get filtered. Glomerular capillaries reunite to form a efferent arterioles which drain blood out of the glomerulus, right? Here the efferent arteriole, your blood are drains out of the glomerulus. Clear? Note, lumen of efferent arteriole is narrower. Your efferent arteriole lumen, it means diameter of your lumen is narrower than the afferent arteriole. Clear? Efferent arteriole divide to form a capillary network called the peritubular capillaries, right? Efferent arterioles get further converted into another capillary networks called the peritubular capillaries, which surround the tubular portions of nephron in the renal cortex. Clear? Tubular portions of your nephron, it's called the proximal convoluted tubule, loop of Henle and the distal convoluted tubule, right? Your peritubular capillaries get surrounded the tubular portion of your nephrons in the cortex region of your kidney, right? Extending from efferent arterioles are long loop shaped capillaries called vasa recta that surround loop of Henle of juxtamedullary nephron in renal medulla, right? Peritubular capillaries and vasa recta reunite to form a renal vein. Clear? For better understanding, I will share you a structure of a nephron and the blood supply to kidney. This is the renal artery from the branch of abdominal aorta. Clear? Here the blood is get entered into the glomerulus and blood is get filtered. Then cleansed blood is returned back, right? And efferent arterioles get further converted into the peritubular capillaries and then surrounded the tubular portion of your nephron. Tubular portion of your nephrons, right? The nephron, the U-shaped structure is called the loop of Henle. Your peritubular capillaries are surrounded. The loop of Henle is called the vasa recta, right? The vasa recta and the peritubular capillaries reunite and form a renal vein, and the renal vein get further converted into a inferior vena cava, right? Drains into a inferior vena cava, right? Now we are going to discuss about the flow chart of your kidney blood supply, right? Now you can see easily the renal artery. This is come from the abdominal aorta, right? It is the branch of the abdominal aorta. Renal artery come into the kidney, and then renal artery get converted into a segmental arteries, right? and segmental artery is further converted into a interlobar artery, then arcuate artery, and then interlobular artery, then afferent arteriole, then afferent arteriole, then glomerular capillaries and efferent arteriole, then peritubular capillaries and vasa recta, then interlobular vein, arcuate vein, interlobar vein, segmental vein, and then renal vein, and finally renal vein drain into the inferior vena cava, right? This is the pathway of blood flow through your kidney, right? Now you can see in the frontal section of right kidney, you can see carefully. This is the red structure. You can see easily the renal artery. It's coming from the abdominal aorta. It is a branch of abdominal aorta. Here blood is coming into the kidney, right? This is the then it's get converted into the segmental artery, right? And then it goes upward. Then it's further converted into a interlobar artery, right? Then interlobar artery is further converted into arcuate artery, and then arcuate arteries further get converted into the interlobular artery. Then interlobular arteries get converted into the afferent arteriole. Then afferent arterioles coming to the nephron structure. Then afferent arterioles coming in get converted into the glomerular capillaries, and then glomerular capillaries is further converted into a afferent arteriole. Here the blood is returned out through the glomerulus, and then efferent arteriole is further converted into a peritubular capillaries and the vasa recta. Then vasa recta is further converted into a interlobular vein, right? Interlobular vein. This is the blue structure, you can see easily. Blue structure is called the vein, interlobular vein. Then it's further converted into a arcuate vein, and then interlobar vein, then into a segmental vein, and then the renal vein. Your blood is drained into a renal vein, and then renal vein is further converted into a inferior vena cava. This is the overview of the blood flow through your kidneys, right? Hope you will understand. Now vascular supply of your kidney or excretory system is commonly called the blood supply of kidney, right? The renal blood supply to the kidneys via the renal arteries, left and right kidneys, which branch directly from the abdominal aorta, right? Your kidney receive approximately 20% of the cardiac output. Clear? After the filtration occurs, the blood moves through the small network of venules that converge into the interlobular vein, right? As with the arteriole distribution, the vein flow the same pattern. The interlobular vein provide blood to the arcuate vein, then back to the interlobar vein, which come to the renal vein, exiting the kidney for transfusion of blood, right? Each renal artery branches into segmental artery divided into interlobar arteries, which penetrate the renal capsule and extend through the renal columns between the renal pyramids, right? The interlobar artery that supply the blood to the arcuate artery that run through the boundary of cortex and the medulla. Each arcuate artery supplies several interlobular arteries that feed into the afferent arteriole that supply the glomeruli. For better understanding, I am going to share you a video about the blood supply of your kidney, right? Arterial supply, nephron, portal system, and venous supply or venous drainage. Arterial supply is the segmental artery. Now, renal artery arise from the aorta at the level of superior mesenteric artery, that is called the SMA, right? It is the inferior vena cava, right? And this is the aorta and this is a superior mesenteric artery, right? The left renal artery, right? You can see easily left renal artery and the right renal artery, right? The red structure is called the right renal, and here is a left renal artery and a superior mesenteric artery. 20% of your cardiac output goes to the kidneys via superior. Now it's come into a segmental artery, right? This is the structure of kidney, and renal artery get converted into a segmental arteries. It's get converted into a five five parts. First is superior, it means apical, anterior superior segmental, anterior inferior segmental artery, posterior segmental artery, and posterior segmental artery. You can see inferior segmental artery, right? You can see easily the five segments of your kidney supplies, right? Each segment artery is an end artery, right? Do not anastomose with adjacent branches, right? Anterior superior segmental artery, you can see easily, right? You can see easily, this is the portion, anterior superior segmental artery, right? This is the anterior superior segmental artery. The yellow arrow here you can see easily. This is the lobes, right? This is the lobes, renal pyramid, or it is called a renal pyramid, renal cortex, right? And these are the papilla, right? Arcuate artery, this is the arcuate artery, right? This is the arc shaped structure making, it's called the arcuate artery. Then interlobular artery, then the cortical radiate artery, right? This is the interlobular artery, cortical radiate the artery. Then it's come into a afferent glomerular artery, right? Afferent glomerular artery. Now we are coming nephron portal system, right? It's come divided into a three parts: afferent glomerular arteriole, right? This is the nephron portal system. Interlobular artery get converted into a afferent glomerular arteriole, right? Supply the glomerulus, right? Supply the glomerulus. This is the glomerulus, right? It is the first capillary nephron portal system. Blood is filtered here and filtrate is formed, right? This is the renal corpuscle, afferent glomerular arteriole, then plasma filter from glomerulus into the Woman's space, right? Plasma is get filtered here into the Woman's capsule or a Woman's space, right? You can see easily and understand. Then filtered or cleansed blood is returned through the efferent glomerular arteriole. Efferent glomerular arteriole, right? You can see easily. Efferent glomerular arteriole transport blood away from glomerulus. Diameters help control GFR. Its diameter helps control GFR, glomerular filtration rate, right? Yeah. Next is peritubular capillaries. Efferent arteriole get converted into a peritubular capillaries which surround the tubular portion of your nephron. It is a second capillary nephron portal system. Your capillaries around renal tubules, right? Here the renal absorption and secretions takes place in the peritubular capillaries, right? You can see easily here the reabsorption that occurs, right? Important ions or substances are reabsorbed and some secretions are here, right? This is the renal tubules and lumen side, and this purple is peritubular capillaries. Here the certain ions or certain substances are present, then get reabsorbed into the peritubular capillaries, right, through the renal tubules. and some substances are secreted like ammonium and acids, and some bases are secreted through the peritubular capillaries. This is the cortical nephron and this is the juxtamedullary nephron, right? This is the structure of nephron. You can see easily and understand. It contains a two capillary bed in series, right? This is the nephron portal system. This is the first capillary bed, and second capillary bed is the peritubular capillaries is the second capillary bed, right? In nephron consists of two capillaries bed, and then is a vasa recta. When the peritubular are surrounded by a U-shaped structure or loop of Henle in medulla region, then it is called a vasa recta. Here the reabsorption and secretions takes place and counter current mechanism are occurred in this region, right? Right, this is the structure of nephron. Peritubular capillaries you can see easily in a purple color, and then it's converted into a venules, right? Then we are coming to venous drainage, right? Venous drainage, interlobular vein, arcuate, interlobar vein, and then renal vein, right? The blue structure is called the venous drainage, right? You can see easily arcuate vein, interlobar vein, interlobular vein, and then renal vein, right? Renal vein drain into the inferior vena cava, right? Right renal vein and left renal vein. You can see easily and understand it. Right renal vein and left renal vein, and then it's get converted into the left suprarenal vein, right, or a adrenal gland, and it's get further converted to the gonadal vein, right? The superior mesenteric artery courses over the left renal vein, right? Your superior mesenteric artery courses over the left renal vein. You can see easily, right? Now aorta get converted into the renal artery, then renal artery get further converted into a segmental, interlobar, arcuate and interlobular artery, then it further converted into a afferent glomerular arteriole, and then it's converted into the glomerular capillary. This is the first capillary bed, and then it further converted into afferent glomerular artery, then it further converted into a peritubular capillary or a vasa recta. It is called the second capillary bed. Then peritubular capillaries further get converted into a venules, and then interlobular and arcuate, then renal vein and inferior vena cava. Your blood is get drainage, right? You can understand easily the vascular supply of your kidneys. Now we are coming the innervations of excretory system or a nerve supply of excretory system, right? Kidney innervations or a nerve supply consist of both afferent and efferent nerves, right? These nerves make up the renal plexus, right? The renal nerve arises from superior mesenteric ganglion and enter the hilum of each kidney and follow branches of renal artery to reach the individual portions of your kidneys or to reach the individual nephrons, right? These nerves consist mostly of sympathetic fibers that triggers vasoconstrictions in kidney, right? And the sensory input from the kidney travels to the T10, and it means thoracic 10 vertebra to thoracic 11 vertebra levels of the spinal cord, and it's sensed in the corresponding dermatome. Thus, pain in the flex region may be referred from the corresponding kidney, right? The nerve supply travels through the T10 to T11 level of the spinal cord and sensed in the corresponding dermatome. Clear? Now, in this section, we are going to look at the nerves involved in bladder. It means urinary bladder, control and maintenance the contents and micturition control center within the brain and spinal cord and response of the neurotransmitters. Clear? Bladder nerve supply or innervation is a complex process and helps both part of the nervous system, right? Your nervous system are divided into two types, that is central nervous system and peripheral nervous system, right? Central nervous system consists of brain and spinal cord, and peripheral nervous system consists of all your peripheral nerves, right? Now, central nervous system. The central nervous system is a nervous system consists of the brain stem, spinal cord, and sacral reflexes. Right? It has a sensory nerves to collect the information and motor nerves to send messages to the muscles like detrusor muscle of the bladder. Right? Right? Detrusor muscle of the bladder controlled by the central nervous system. Clear? Peripheral nervous system include outside the brain. Its main function to connect the central nervous system to the limbs and the organs, relaying messages between the spinal cord and the rest of the body. Is clear? The peripheral nervous system is divided into the somatic nervous system and the autonomic nervous system. Somatic nervous system main function is voluntary, right? Main function is voluntary control to the pelvic floor and external sphincters. This enables to pelvic floor exercise, right? The autonomic nervous system regulates the function of internal organs like the bladder. As its name suggests, it acts autonomically and subconsciously, right? The autonomic nervous system is made up of the sympathetic nervous system and the parasympathetic nervous system. Clear? These two systems have an antagonistic and opposing effect on the bladder, right? For better understanding, I can share you the image. The bladder, nerve supply, urinary bladder nerve supply. This is the structure of our brain. It means cerebral cortex, then spinal cord, right? Hypogastric nerve, the sympathetic nerve, right? This is the urinary bladder, right? T10 to T11 vertebra. This is the hypogastric nerve get stimulated the bladder, and this is the pelvic floor, external sphincters, voluntary muscles, and the pudendal nerve, right? Your pudendal nerve are come into the somatic nervous system, and it's your voluntary and it's your control, right? You can see easily and understand easily nerve supply of your bladder, right? Through the hypogastric nerve, pudendal nerve, right, and pelvic nerve, right? Your nerve supply get occurred through the hypogastric nerve, pudendal nerve, and the pelvic nerve, right? The pelvic nerves which originates the S2 to S4, it means sacral 2 vertebra to sacral 4 vertebra level of the spinal cord are the main parasympathetic nerves, and they make you pee, right? They cause constrictions of the detrusor muscle and relaxation of the internal sphincters, right? The hypogastric nerves which originate at the T10 to T12 level of the spinal cord are the main sympathetic nerve, and they stop you peeing, right? They promote detrusor relaxation and internal sphincter constriction. It means your urinary bladder are under control in both parasympathetic and sympathetic nervous system, right? The pudendal nerves which originate at the S2 to S4, it means sacral level 2 vertebra to sacral level 4 vertebra of spinal cord, and are the main somatic nerves that innervate the static muscles of the pelvic floor and the external sphincters, right? Your urinary bladder are supplied nerve supplied by the pelvic nerves, hypogastric nerve, and the pudendal nerves. You can understand easily through the pictures, right? Now we are coming to our next topic. Next topic is vascular access, right? Vascular access directly means a way to get your blood, right? A way to get your blood. Vascular, it means blood, and the access a way to get there, right? For hemodialysis, or in hemodialysis, blood need to be able to leave your kidney, right? Blood travels the artificial kidney and return to your body. and other words for vascular access. It's called a fistula, graft, and a catheter, right? Fistula is the second most common but is the best type of access for most people, right? Fistula is made with the connecting a person artery and a vein, usually in the arm, right? Graft, the AV graft, is similar to the fistula in that it is also an under the skin connection of an artery and a vein, and a man-made tubing connects the artery and vein, right? The soft plastic like tube is about half inch in diameter and it is made from a type of Teflon or a Gore-Tex material. The graft usually placed in the arm but can also be placed in the thigh, right? A catheter. Next is catheter. A catheter is used as a temporary vascular access when a patient suddenly discovers they have a kidney failure. Catheter may be placed to allow immediate dialysis treatment, right? This is a temporary vascular access. Permanent vascular access are come into a divided into a two types. Fistula and AV graft are the type of the permanent access, right? AV fistula, you can see easily AV fistula and the AV graft, right? The artery, your artery and veins are get connected, then you are making a fistula, right? And then you can cannulate easily and your blood get access through the AV fistula, right? Your radial artery and cephalic vein are get connected into the arm of your patients and making the AV fistula for making the access, the way to get your blood through the patient's body through the AV fistula, right? And another is AV graft. Here the U-shaped or a tube-like structure get placed between the artery or a vein and making and get diverting the pressure of artery into a vein. Then it form a AV graft, and through this access we get a blood from the patient's body, right? This is the type of permanent access in dialysis, in hemodialysis patients. Now the temporary access is subclavian vein insertion and the internal jugular vein insertion, and then is a femoral. Yeah, this is the femoral vein. You can insert a catheter into the femoral vein. You can easily this is the easy way to get blood from the patient's body, right? This is a femoral. You can insert a catheter into the femoral vein in patient's body and access the blood through this catheter, right? And this is the jugular vein insertion, right? Your catheter get inserted into a external jugular vein in the patient's body. Your blood is get your patient's blood get you achieve a patient's blood, and then your get patients get hemodialyzed, right? And subclavian vein insertion, your subclavian you are inserted your catheter into the patient's subclavian vein, right? And this is the temporary access for blood vascular access for dialysis patients. Clear? Thank you.